Periodontal disease is, it starts out as gum disease, but I really think it should have been named something else because it's actually a disease that quietly takes place underneath the gum and it destroys the bone that's around the tooth. What we do to check to see if you have periodontal disease is we use something called a probe, and it has marks on it. It's just like a little measuring device, and it's marked off in millimeters. So to determine if you have periodontal disease, we just take the probe and insert it underneath the gum, and eventually it's going to stop, and it's in a healthy situation it stops where the gum is attached to the tooth. Periodontal disease causes the attachment of the gum to the tooth to be eaten away. That's the gum disease part. So when we go down underneath the gum, if we're measuring 2 to 3 millimeters, we know you're okay. When gingivitis sets in, the gum starts swelling. So when I probe and hit that attachment, it's actually, the swelling makes the probing depth be deeper. So if that's the case, you just have your teeth cleaned and the swelling goes down. We go back and measure it, and the probing depths are back to 2 to 3 millimeters. Disease gets past the gum, it starts into the bone. And what I'm going to do is take this, this gum off of this model and show you the healthy side. Underneath the gum, the tooth should be completely surrounded by bone. That's what's actually stabilizing it in your mouth, in the jaw. When you have periodontal disease, that bone is actually lost. So when we probe down into the gum, we have to go further and further to get to where the attachment is. And the bone is actually being eaten away around the tooth, and the tooth can become mobile. The teeth can start flaring. If you've been told you have periodontal disease or you think you have periodontal disease, we'd love to see you.
Call today to set up your free consultation. 404-255-9511. 404-255-9511. Dr. McLaurin is in the medical quarters at Peachtree Dunwoody.